Hello, my name is Dr. Adam Hyatt and I'm a surgeon at Orthopedic Associates of Lancaster. I also have specialty training in sports medicine and sports surgery, and I did a fellowship at the Rothman Institute in Philadelphia specifically to address sports-related injuries. The following is a presentation of some of the common sports-related injuries that I see in my practice. We'll go over the diagnosis, treatment, and some prevention tips to help you stay healthy in musculoskeletal health. As I said before, I'm excited to be a part of the Lancaster community here at OAL. I grew up in Eastern Pennsylvania, and then from there went on to Pennsylvania State University. After graduating, I went to medical school at Thomas Jefferson University at Jefferson Medical College in Philadelphia. I did my residency training in orthopedics at Rutgers University at Robert Wood Johnson University Hospital in New Brunswick, and I did my fellowship training at the Rothman Institute at Thomas Jefferson University Hospitals, and had the opportunity to treat many athletes from high school to college age at Villanova University, at St. Joseph's University, as well as interacting and treating professional sports athletes with the Phillies, Flyers, and Eagles. I'm excited to be here at Orthopedic Associates of Lancaster to continue to deliver care to athletes of all ages. Some of the objectives today will be to discuss some common athletic injuries that sports medicine physicians and athletic trainers commonly encounter. We'll discuss treatment options that vary from rest, rehabilitation, anti-inflammatory medications, to surgical procedures. The key with preventing sports injuries is you want to take small steps to avoid some big problems. So how do people get injuries? It can occur in youth leagues, high school sports, collegiate sports, professional sports. Sometimes it depends on what position you play. Why did it happen? Well, it could be for exercise, fun, recreation, or even monetary compensation. But the treatment really depends on you. There's no holy Bible of orthopedic care. Musculoskeletal complaints are the number 2 reason that people seek medical treatment, which is a close second behind upper respiratory infections. More people than ever are involved in athletic play. This means that more people are getting overuse and traumatic injuries. And this talk could be bad for my business. So we could talk about some sports-specific injuries. Overhead or throwing athletes, such as baseball players, softball players, swimmers, volleyball players, you should think about the shoulder. And contact athletes, such as football, rugby, or lacrosse players, think about everything, from the shoulder to the hip to the knee. Think about fractures, sprains, and ligament injuries. Endurance athletes, such as soccer athletes, track, cross country, and basketball, think about overuse injuries, such as tendonitis, cartilage wear, and soreness. And other random athletes like golfers or bowling, think about upper extremity injuries, tendonitis, and wrist pain. Patient-specific sports injuries. In female athletes, think about patellofemoral disorders, disorders of the kneecap, ACL injuries, and ankle sprains. In men, think about fractures or dislocations. In kids, we think about fractures or growth plate disturbances. In middle-aged adults or weekend warriors, think about Achilles tendon ruptures, tendonitis, or patellar tendon ruptures. In the more elderly population or advanced age, think about arthritis, joint soreness, and quadriceps ruptures. It's helpful to go over some definitions so we all are speaking the same language. When your doctor talks about the bursa, he's referring to the specialized tissue, which is a potential sac in the anatomic places where friction occurs to allow smooth, non-irritating motion of one surface over another. An example would be the olecranon bursa over your elbow. When this becomes inflamed, we call it a bursitis. A tendon. This is a cord-like, primarily collagenous structure that links muscle to bone. If inflammation occurs, it's called tendonitis. Tendon degeneration. Degenerative changes are seen in a great majority of tendons, indicating that spontaneous tendon rupture is a typical clinical end-state manifestation of a degenerative process in the tissue. The role of overuse in the pathogenesis of chronic tendon injuries and disorders is really not completely understood. It's been speculated that when a tendon is overused, it becomes fatigued and loses its basal strength. We talk about a watershed area in tendons, and this is an area where blood vessels traveling from each end of the tendon don't completely reach the midpoint, and there's a relative avascularity. Mechanical effects such as abrasion can have implications in tearing of these tendons. When we talk about a ligament, we're talking about a dense connective tissue that links bone to bone. And when your doctor refers to arthroscopy, he's talking about a procedure. This is one where we use a few pinky nail-sized incisions around the joint and we're able to look inside with a camera and view it on a screen. We actually inject the joint with water to allow us to see. We then use specialized tools to either repair or remove damaged tissue from within that joint. So why do sports-related injuries happen? If viewed as a function of Newton's third law, athletic injury can be described as resulting from an equal and opposite reaction, which in turn is result in macro or micro trauma. In macro trauma, equal and opposite forces exceed the strength of a specific anatomic structure. In micro trauma, you get smaller traumas from repeated activity, and these can be cumulative. Over time, this can result in inflammation, pain, and dysfunction. Now I'd like to talk a little bit about shoulder injuries. It's important to understand the anatomy and biomechanics. And you think about the shoulder, it represents a ball on a tee, and that's a pretty good analogy. The shoulder joint is different from other joints in the body in the sense that the stability of the joint, what keeps the joint in the socket, is not provided by the bony anatomy. Another analogy is the golf ball and the golf tee, as I demonstrate here. The ball part of the joint is represented by the golf ball, and the tee represents the glenoid, or the bony part of the joint. In essence, the stability of the shoulder is based on a balance of forces. The forces in the front must equal the forces in the back, and the forces on top must equal the forces on the bottom. And if they don't, the balance of the joint is altered, and the result is pain and dysfunction. Shoulder dislocations. The shoulder joint is the body's most mobile joint. It can turn in many directions, but this advantage also makes the shoulder an easy joint to dislocate. A partial dislocation, called a subluxation, means the head of the upper extremity, the humerus, is partially out of the socket, the glenoid, as I mentioned before. A complete dislocation means it's all the way out of the socket. Both partial and complete dislocations can cause pain. The diagnosis of shoulder dislocations is usually pretty obvious. In general, people know that they truly dislocate their shoulder and often requires a visit to the emergency room to have it put back in. The diagnosis is usually confirmed on X-ray, and we also can use an MRI to further evaluate soft tissue injuries. Treatment is based on the age of the patient, the activity level of the patient, and the degree of impairment. Oftentimes, after people have dislocated their shoulder for the first time, non-operative treatment consisting of physical therapy can be useful for getting people back to normal function. Recurrent dislocations or high-level athletes usually require surgical fixation. A shoulder separation. This is a common injury making up about 9% of shoulder injuries. More common in males, and the mechanism is usually a direct blow to the point of the shoulder seen when falling onto the shoulder. Treatment is typically rest, ice, and a sling for about 3 weeks, followed by rehabilitation for early range of motion, regain of function, which typically occurs by 6 weeks, and return to normal activity at about 12 weeks. Frozen shoulder. This is also called adhesive capsulitis. It causes pain and stiffness in the shoulder. Over time, the shoulder becomes very hard to move. Frozen shoulders occur in about 2% of the general population. It most commonly affects people between the ages of 40 and 60 and occurs in women more often than men. The causes of frozen shoulder are not completely understood at this time. There is no clear connection to arm dominance or occupation. A few factors may put you at risk for developing a frozen shoulder, such as diabetes. There are 3 stages. There's freezing, frozen, and thawing. More than 90% of patients improve with relatively simple treatments to control pain and restore motion. Non-steroidal anti-inflammatories can reduce pain and swelling. A cortisone injection can be a powerful anti-inflammatory medication that's injected directly into the joint. And the mainstay of treatment is also physical therapy. Next, we're going to talk about rotator cuff tendonitis and tears. Your arm is kept in the shoulder socket by your rotator cuff. The rotator cuff is a network of 4 muscles that come together as tendons to form a covering that surround the head of the humerus. The rotator cuff attaches to the humerus to the shoulder blade and helps it lift and rotate your arm. The rotator cuff is a common cause of pain and disability among adults. In 2008, close to 2 million people in the U.S. went to their doctors because of a rotator cuff problem. A torn rotator cuff will weaken your shoulder. This means that many daily activities like combing your hair or getting dressed may become painful and difficult to do. Repetitive stress, meaning repeating the same shoulder motions again and again, can stress your rotator cuff muscles and tendons. Baseball, tennis, rowing,
weightlifting. Those are examples of sports activities that can put you at risk for overuse type injuries. Many jobs and routine chores can cause overuse tears as well. A lack of blood supply is also implicated. As we get older, the blood supply to the shoulder, the body's natural ability to heal and repair tendons is limited and impaired. This can ultimately lead to a tendon tear. You can also have bone spurs. As we age, bone spurs or bony overgrowth can develop in the arm and also be a risk factor for developing a tear. An important part of this talk is about prevention. Shoulder injuries can be prevented by following some simple guidelines. This should include an assessment and a management and following key areas. Poor performance and shoulder pain commonly originate by bad habits of techniques. Often, they are only clearly seen when the muscle fatigue sets in. The variety of overhead movements required for each sport gives rise to very subtle and unique technical flaws. There are 5 keys that I'm going to talk about today. One of them, as I said before, sport-specific technique. Next is flexibility. For the rotator cuff, the critical issue is the balance of forces centering the head and the humerus, and to a lesser degree, freedom of movement. It's more critical that the internal and external rotators are equally flexible. Core stability is critical for the inner core of the body to provide a stable, strong support for the shoulder to work off of. The shoulder girdle needs a good foundation. If these areas are not stable, significant extra loading and strain is passed on to the shoulder. In addition to that, rotator cuff control and generalized strength are very important for maintaining healthy muscle control. A sedentary lifestyle has been proposed as a main reason for poor basilar circulation for tendons and presumably is at least partly responsible for a high number of tendon problems in people with sedentary lifestyles who occasionally take part in high physical or activity sporting demands. Remember, treatment is always patient-specific and tailored towards your specific needs. Some final thoughts and resources for you to visit for musculoskeletal-related injuries. Overuse injuries and tendon degeneration have been speculated to cause chronic tendon problems by disturbing the micro and macrovascular structure of the tendon, resulting in insufficiency and local blood circulation. Decreased blood flow simultaneous with an increased activity may result in a decreased oxygen capacity, impaired nutrition, and energy metabolism. And together, these factors are likely to play a role in the sequence of events leading up to a specific injury. It's true, an ounce of prevention is worth a pound of cure.